Did you know that breast cancer is the second most common malignancy in women? Yes, it's a fact. With the lifetime risk of developing breast cancer for women in the United States hovering around 13%, it's essential to know more about this disease. Breast cancer risk factors are numerous, but the most significant ones boil down to increased estrogen exposure, advancing age, and genetic predisposition. The latter can be due to mutations in specific genes such as BRCA1 and BRCA2. The majority of breast cancer tumors are referred to as adenocarcinomas. Among these, invasive ductal carcinoma and invasive lobular carcinoma are the most frequent types. The former is more aggressive than the latter, but both require attention and treatment. Detection of breast cancer usually occurs during routine mammography screening, which is recommended for women starting at 50 years of age. If the mammography reveals abnormalities or the presence of breast masses, further radiographic evaluation is necessary. And if signs of malignancy appear or results remain inconclusive, a biopsy followed by a histopathologic analysis is the next step. Axillary lymph node status, a crucial determinant of cancer spread, is ascertained through clinical examination and biopsy of suspicious lymph nodes. Treatment of breast cancer is a multifaceted approach, primarily depending on the cancer stage and histopathologic classification. It often involves a combination of surgical resection, radiation, and systemic therapy. The surgical route can be breast-conserving or may involve the removal of all breast tissue on the affected side, a procedure known as a mastectomy. In some cases, it might even be necessary to remove both breasts. Systemic therapy is determined by the tumor's receptor status. For instance, if the tumor is positive for estrogen or progesterone receptors, hormone therapy such as tamoxifen can be administered. If the tumor is positive for HER2 receptors, targeted therapy such as trastuzumab is the treatment of choice. The prognosis of breast cancer depends on multiple factors, with cancer stage, tumor receptor status, and DNA aneuploidy being the most impactful. Finally, women at high risk of developing breast cancer, such as those with a positive BRCA mutation status, should be offered risk-reducing prophylactic measures. These can include a bilateral prophylactic mastectomy. To recap, breast cancer is a common malignancy in women, with risk factors including increased estrogen exposure, age, and genetic predisposition. It is usually detected through mammography, with further tests if required. Treatment depends on the cancer stage and type, involving surgery, radiation, and systemic therapy. Prognosis is based on several factors, including cancer stage and tumor receptor status. High-risk individuals should consider prophylactic measures to reduce their risk. Being informed is the first step towards prevention and early detection, so keep these facts in mind and remember to prioritize your health.